name is Alia. I like to go out and have fun. Accessibility means to me when I go to a place easy, and disability is important to me because sometimes I will be myself, knowing next to me first to ask for help, and I have to look away to do it myself because no one next to me the whole time.
My name's Rich. I live with the Center for Disabilities for about 10 years now. I live in my own apartment. It's been an awesome experience living there because that's where I learned a lot about the medical field. I've experienced many successes since I've come to the Center for Healthcare because the Center Healthcare people really do take the time to, at least in my experience, to really listen.
I'm Pam Menton. This is my son, David Nichols. He is 33. He was diagnosed with forms of cerebral palsy when he was almost a year old. And since then, it's just been following through with doctors and surgeries and doctors and visits and therapies and just learning how to be the best advocate you can be, because I tell people that you may have other people you have to deal with. I have one. Accessibility kind of comes and goes. It depends. Mostly now things are pretty good. And there have been a couple of places where we have gone and I have brought the issue to the office staff. And if they're not really responsive, then I will call, the office managers and say, where is your handicap spot? Why do you only have one? Where is your sign? Because, it's a law. And, don't be afraid to ask those questions and push those things, because that's how it gets done.
My name is Torrin Farrell, and I'm a big advocate for ADAPT. I advocate for everybody that needs help to be spoken up for, that can't really speak for themselves. And my experience with the healthcare is that we all have to fight and always get into disagreements about getting equipment or medication or anything like that. The challenges for healthcare is that they want to cut things, and we're trying not to have anything cut, because with all the stuff that we need to help us get around in our lives are very helpful, and we need this services to continue instead of being always cut.
The doctors are kind and considerate. A lot of times I think it is the general flow of the office. Insurance doesn't allow for time. And we have complicated issues that take time.
It's been 35 years and we have quite a bit of experience dealing with the medical world. We come in sometimes and they're thinking, wow, this is going to be complex with the insurance coverage. And luckily we have very good insurance.
You're my girl.
You're a super mom.
Yeah, you're a super girl.
We had difficulty getting gastroenterologist. We've seen primarily the nurse practitioner. That coordination, we have to see the physician at some point in time, and that just didn't happen here. And I'm not faulting the issue, but it's just that sometimes you think it's going to happen and you don't. So when you think you're going to see a provider, you really want to see the provider you think that you want to see.
Another challenge that we have is insurance. A lot of providers do not take Medicaid and Medicare, which our folks have. We have a really hard time getting dental services for our folks, especially. Often we have to go downstate, and we're waiting months and months, and then a lot of times, in some cases it's years. We've been on a wait list for a couple of years to have extractions with anesthesia done. That's been a huge hurdle for us. And then something as little as eyeglasses are very difficult for our folks to get that have Medicaid and Medicare. And then some of the places, a few places that do accept it, are not accessible. It's hard to get in. The offices are very small.
Some will have steps that you can go up. Some will have narrow doorways. You always have to make sure, if you have to go to the ladies' room, you got to make sure that's accessible. If that's not, you have to do something else.
Parents are just in a world that they just never dreamed of. Caregivers are in a world they've never dreamed of. And so they don't know what they need to do. They don't know who to contact. It's just this huge mass of paperwork and forms and online and visits. And in the beginning, you are just totally blown out of the water. You're still trying to deal with the whole, what's this diagnosis and what does it mean? And so really, until you really get your feet underneath, you're really relying on anybody who'll listen to you. And if you're fortunate enough to have service coordinators that know their job and have empathy for the job, that's an incredible help.
We need to educate the system, I think, is the problem. It's not the medical care, it's more the system of how it's provided. I think that sometimes the offices have to have a little bit more patience with the type of care we require. It's not that they don't want to give it to us, it's just that it's complex and it takes time.
Our young people, the men and women in our systems, have very special needs, and it takes very special care and good training to understand how to diagnose and treat in a way that's not over-prescriptive or we undertreat. So people with developmental disabilities have communication needs. Having just said that, they're very resilient. So in some cases, I think they're much tougher than the average young person.
Talk to them and try to make them think about us.